Sedentary living due to pandemic restrictions is leading to lifestyle diseases. For instance, people working from home are becoming less physically active and binging more on snacks that are higher in salt, fat, and unwanted sugar. One common condition resulting from these behaviors is hypertension, and one of the most dangerous and also one of the conditions. That is why it's called the silent killer, but it doesn't have to be. I'm Dr. Freddy Gomez, and we'll bring you the knowledge and care you need, especially in this time of COVID-19. You're watching MedTalk Health Talk on CNN Philippines. Watching your blood pressure is important because your arteries carry blood from your heart to other parts of the body. Our guests today will talk about this topic and share their knowledge. Let's welcome Dr. Eduardo Yambao Jr. He's a cardiologist from the Asian Hospital and Medical Center. Also with us is Dr. Romel Punongbayan, who is an internal medicine and hypertension specialist from the Medical City Clark and Bulacan Medical Center. Most of the time, hypertension has no obvious symptoms to indicate that something is wrong. One thing you can do to protect yourself is by checking your blood pressure. In a blood pressure reading, there are two numbers, itong systolic and the diastolic. I'll start the conversation with Doc Ome. Please explain what this means and ano ba yung normal BP range na dapat makita natin?
The normal BP that we have to really attain is 120/80 and below. However, the technique of taking your blood pressure is really crucial. So if you do your blood pressure taking in a public place, probably you can have an inaccurate blood pressure reading. But in general, we have to really make sure that we are taking the blood pressure the right. So it has to be quiet. You have to be seated comfortably with your back support, your feet are flat on the floor, and your measuring device should be in the level of your heart. So however, most of the cases, I'm seeing a lot of technical errors. So it's really very crucial to take your blood pressure properly.
Now, a hypertensive crisis means that there's a severe increase in blood pressure, and one of the risk factors for this is a stroke. When this happens, the heart may not be able to pump blood properly. Dr. Ed, if one notices a spike in their BP, biglang pagtaas, what should their initial reaction be?
When there is a sudden spike in blood pressure, they should first check, number one, if they are into certain stressors which could cause elevated blood pressure. This would include probably they are in certain activities like exercise, or they're really shouty or laughter, or they may have a recent intake of food that may elevate your blood pressure, like salty food or foods high in fat or caffeinated drinks. After ruling this out, they have to also make sure that they properly took their medications. But if the blood pressure is still on the high side, then they might need to immediately sought consult with their attending doctor, or if it doesn't really go down, they should go to the emergency room.
Now, hypertension is one of the leading causes of illness and of premature death here in the Philippines. The usual suspects that may cause this are the food we eat. In the Philippines, we love to eat fatty and oily food such as adobo and sisig, which can contribute to an increase in someone's blood pressure. Dr. Ome, aside from a person's diet, what are some of the risk factors for hypertension?
Actually, the more common really risk factor for hypertension is number one, genetics. Then the more popular ones are alcohol intake, smoking, being sedentary or doesn't have any physical activity. Even obesity and diabetes mellitus are the more common risk factors for hypertension.
We already know that smoking is bad for our lungs, but it also increases our risk for heart disease as well as hypertension. Dr. Ed, explain naman natin yun. How does this happen naman? Why is smoking always the culprit sa lahat ng mga masamang bagay sa katawan?
The nicotine in the cigarette can cause the blood vessels or the tubes that carries blood in the body to weaken, or they become narrow also. The nicotine also leads to faster heartbeat, and this all leads to an elevated blood pressure. That's why if we will quit smoking, the blood vessels will improve, the blood pressure decreases, and the risk for heart disease or heart attack will also decrease.
Now, aside from smoking, drinking too much alcohol can also increase our blood pressure to unhealthy levels. Having more than 3 drinks temporarily increases the blood pressure, but repeated binge drinking can lead to long-term increases. How does alcohol affect someone's blood pressure?
When a person drinks alcohol, so usually the heart rate increases because it excites our body. And with the increase in heart rate, there would be a concomitant increase in blood pressure. And if there would be a constant exposure to this increase in heart rate, then patient would eventually have long-term hypertension and would not just be a situational increase in blood pressure.
Earlier, you mentioned that one of the really significant factors sa hypertension ay ang genetics or napagmamanahan nito. Now, if someone has a strong familial line of hypertensive parents, grandparents, whatnot, what can they do about this?
Since the genes are unmodifiable, so we cannot modify the genes, what we can do is just to delay the onset of your hypertension. So there have been a lot of genes related to hypertension, and definitely 30 to 60% of hypertensives are still the hereditary ones, the inherited ones. We call it the primary or the essential hypertension. So technically, what we can do is just to delay by modifying our lifestyle.
Now, people with high blood pressure puts themselves at higher risk for COVID-19 due to their weaker immune system. Doc Ome, what can people with hypertension do to protect themselves from coronavirus since it's still with us up to now?
Hypertension will, with the implication of your ACE2 receptors and the abnormalities in your renin-angiotensin system and some other receptors like your toll-like receptors, which is responsible for inflammation. Hypertensive patients are really at risk for acquiring the COVID virus. So what they can do is to just continue their medication so that their blood pressure is within normal levels. Probably it will lower the risk for them to acquire the infection.
Doc Ome, as a follow-up to that, with regards to vaccinations, there's been a lot of conflict, especially when it comes to the vaccination sites. Hindi pumapasa yung mga hypertensives dahil mataas ang BP nila, either hindi nila nakukuha yung booster nila or vaccination nila. What is the current guidelines now? Ano bang dapat alalahanin ng mga hypertensives whenever they get their vaccine or their booster?
They have been instructed to continue their hypertension medications before going to the vaccination site because, Filipinos are really needle phobic. So when they go to a vaccination place, there's an increased stress. So the tendency is for them to elevate their blood pressure. So the better thing to do is before going to the vaccination site, make sure that you take your regular antihypertensive medication.
Now, when left undetected, hypertension can cause a number of problems. When we return, we'll talk about the complications of hypertension. We're your connection to healthcare. You're watching MedTalk Health Talk. High blood pressure can silently damage the body for years before showing any symptoms. Uncontrolled high blood pressure can cause disabilities, poor quality of life, or even a heart attack. I'm Dr. Freddy Gomez, and you're watching MedTalk Health Talk. We're together in health. The excessive pressure on your artery walls caused by high blood pressure can damage your blood vessels as well as other organs. Now, the higher the blood pressure and the longer it goes uncontrolled, the greater the damage here. Now, Dr. Ed, what are the most common complications that are caused by consistently elevated, uncontrolled high blood pressure?
There are a lot of complications from uncontrolled high blood pressure. This includes heart attack or stroke, heart failure or inability of the heart to adequately supply oxygen throughout the body. Aneurysm can also arise, which means there is weakening and bulging in the walls of the blood vessels. Patients can also have eye problems like blurring of vision, bleeding in the eyes, or double vision. And long-term, uncontrolled high blood pressure can eventually also damage the kidneys.
Healthy arteries are flexible, they're strong, they're elastic, and their inner lining is smooth so that blood flows freely to supply vital organs and tissues with nutrients as well as oxygen. Now, hypertension gradually increases the pressure of blood flowing through those arteries. Dr. Ed, when it comes to our arteries, a lot of our viewers are familiar with cholesterol and its effects on the heart. What is the relation with this with elevated high blood pressure?
If there is elevated high blood pressure, the arteries in the heart and the rest of the body becomes less elastic. And when they become less elastic, they cannot function well, which is they cannot supply the adequate oxygen and nutrients. Because of this, heart disease can eventually happen. That's why in prolonged and uncontrolled hypertension, patient can have heart failure, or they could also have ischemic heart disease, or the heart muscle not having adequate oxygen, or eventually they could have heart enlargement. And they would feel shortness of breath, they could experience chest pain, or they get tired easily when this happens.
Now, elevated blood pressure, as explained, can cause many heart problems such as coronary artery disease, enlarged left heart, as well as heart failure, as Dr. Ed mentioned. But Dr. Ed, nowadays we associate all of these elevated blood pressure with a certain body type, with diet, too much cholesterol in the diet, too much unhealthy eating or whatnot. But is that the case nowadays? Meron bang itsura ang isang hypertensive? Or can someone look healthy outside but still be hypertensive?
A person can look normal outside, like for example, being on the normal weight, normal build, but can still be hypertensive. And because genetics, as what Dr. Punumbayan also mentioned, do play a big role in high blood pressure. This brings to the importance of having a regular follow-up and regular monitoring of blood pressure. And other factors like food, obesity could just factor in or further aggravate a person with genetically predisposed condition to develop hypertension.
Now, hypertension can also damage the brain because our brain depends on a nourishing blood supply to work properly. Dr. Ome, can you talk more about high blood pressure and its relation or its risks sa ating brain?
Actually, when we talk about hypertension and brain, we are talking more of the complications of hypertension, which is stroke. And it's around less than 50% of the time, hypertension is the cause of stroke. So this can lead to morbidity, like paralysis or poor quality of life, and some even die because of a certain fatal stroke due to hypertension.
Kidneys filter excess fluid and waste from the blood, a process that requires healthy blood vessels. Now, high blood pressure can damage those blood vessels, as we learned earlier, in and leading towards the kidneys. Dr. Ome, explain natin yon, yung link naman with hypertension and paano naapektuhan ng ating kidneys.
Hypertensive patients has elevated sympathetic tone and endothelial dysfunction. There's also water retention and salt retention. Eventually, will destroy the blood vessels of the kidney. And this will lead, at worst, they go to dialysis.
Let's talk about the eyes, because hypertension can also damage the blood vessels that supply blood to the eyes. And this can cause retinopathy, choroidopathy, or even optic neuropathies. Dr. Ome, pag-usapan naman natin yon, yung link of hypertension tsaka sa mata.
Because when you are hypertensive, your blood vessels in the eyes, specifically at the retina, will have some abnormal changes. There will be thickening of your intima, and there will be increased degeneration of the hyalin of the blood vessels of your eyes. Eventually, this will lead into poor circulation, and eventually, this will even cause blindness.
Okay. Now that we know what hypertension can lead to, it's important that we know how to lower it and stay healthy. Your health is our mission. This is MedTalk Health Talk. If you've been diagnosed with hypertension, you might think about taking medications to bring your numbers down. but lifestyle plays an important role in lowering your blood pressure as well. I'm Dr. Freddy Gomez, and you're watching MedTalk Health Talk, where your care always comes first. If you successfully control your blood pressure with a healthy lifestyle, you might avoid, delay, or even reduce the need for medications. Dr. Ome, what lifestyle changes should one make to lower their blood pressure?
Diet and lifestyle really has a great impact on the blood pressure. So we have to have a regular exercise, not being sedentary. So at least it's more of most days of the week, at least 30 minutes moderate intensity cardio or aerobic exercise. And definitely we should have a good diet. Specifically, we call a good diet DASH diet approach to stop hypertension. This is composed of whole grains, vegetables and fruit, less of saturated fat and trans fat, high in potassium, and definitely low in sodium. This is a great way to lower your blood pressure as much as 10 millimeters mercury on your systolic blood pressure.
Having high blood pressure typically shows no symptoms, which is why it is important to have yourself checked regularly by a medical expert. But home monitoring can also help you keep tabs on your blood pressure and if certain lifestyle changes are working. Now, make sure to talk to your doctor before you buy a gadget for home monitoring of your blood pressure. Dr. Ed, how can we properly check our BP at home? Let's start first with ano ba yung maganda to have at home? Anong klaseng gadget? We have electronic ones, we have the manual ones, we have the wrist ones even nowadays. What is your recommendation?
For home BP monitoring, since usually it's the person himself will check his blood pressure, it is ideal that he use an electronic or digital BP monitor. It could either be a wrist digital monitor or the arm digital monitor, and make sure it's properly charged or it has an adequate battery so that it could function well. Then he should find a right place, a quiet place where he is relaxed, and then sit down and make sure that there's no tight-fitting clothes affecting the arm where the BP cuff will be placed. After which, place the arm just at the level of the heart and the blood pressure cuff above the elbow.
Okay.
Then the person should keep still and quiet while the machine is taking the blood pressure. Then after taking the measurement, he could take another 2 or 3 readings, then compare it. And ideally, the person should also record the blood pressure measurement so that he could show the readings to his doctor on follow-up.
Now, Dr. Ome, nowadays with technology, there are a lot of gadgets that help with monitoring one's blood pressure. Even watches can do it nowadays. But how accurate are these? Are these something that gives as accurate an information as what hypertension specialists or cardiologists use in their clinic?
Actually, most of the wearables, we call it the wearables, are still in the process of validation. Some of the gadgets can monitor your heart rate, can monitor the calories burned. But regarding the blood pressure, I'll still recommend those machines that has been mentioned by Dr. Ed. So these are more accurate because they are validated already. And fitness trackers are just probably an adjunct to the risk factors, like if you do exercise, how many calories do you burn, what is your target heart rate. Probably this is the practical usability of your tracker to track your physical activity and your parameters while doing some interventions to alleviate your high blood pressure.
Now, this discussion was indeed very helpful. And with that, I'd like to thank cardiologist Dr. Eduardo Yambao Jr. and hypertension specialist Dr. Romel Punongbayan for sharing your expertise with all of us today. Hypertension may be the silent killer, but it can often be prevented or reduced by eating healthy, maintaining proper weight, regular exercise, and not smoking. We want to be your partner for a lifetime of good health. I'm Dr. Freddy Gomez, and this is MedTalk Health Talk on CNN Philippines. We'll see you next time.